Good morning, everybody. Yesterday, New South Wales had 148,000 people who came forward to get vaccinated. Another huge day and a day we're deeply grateful for. It's really assisting us in getting to that 70% double dose figure sooner than we had anticipated. So that's fantastic news. We also had over 170,000 people come forward for testing. So huge numbers coming out to get the jab and also to get tested. We had 1,116 cases of community transmission in the last 24 hours to 8 p.m. and regrettably 4 people lost their lives with COVID, and we extend our deepest sympathies and condolences to their families. 4 females who unfortunately weren't vaccinated and who did have underlying health conditions. A woman in her 50s, one in their 60s, one in their 70s and one in their 80s. And again, we extend our deepest condolences to their loved ones. It's very pleasing to note that New South Wales is demonstrating our capacity for record vaccination rates, leading the nation. And I just want to remind everybody that September is the month when we're asking everybody to get ready. Get vaccinated if you're an individual, and if you're a business, start dusting off your COVID safety plan. Make sure that your employees are vaccinated so that we can get back to life at 70% double dose vaccination, which we anticipate will happen somewhere around the middle of October. And that's certainly the date we're working towards. Initially, it was the end of October, but because everybody's coming forward at the rates we're seeing people come forward, that could be as early as the middle of October. And when we hit the 80% double dose number, which we anticipate will be in November, New South Wales looks forward to having our citizens enjoy international travel. And also, New South Wales looks forward to stepping up and welcoming thousands of Australians home who've been waiting to come home for a long time. And as I've also said, once you hit that 70% double dose number, hotel quarantine looks very different, quarantine looks very different, the way we manage the disease is very different, the way that we manage tracking and tracing is very different. And I'm having these conversations now with everybody so we can get used to what life is like in living with COVID. And again, I restate our position, which we stated from the outset. It is impossible to eliminate the Delta strain. New South Wales has proved very successful until this point in time in getting rid of other strains of COVID, but the Delta strain is a game changer. And every state in Australia, sooner or later, is going to have to live with Delta. And that's why I'm calling on all my colleagues, all other state premiers and first ministers to stick to our plan, stick to the national plan, to make sure we give our citizens not only the freedoms they deserve, but also learning to live with COVID as soon as we can. I'm also very pleased to have with us today Dr. Ahmed Al-Rabai from Bankstown Hospital. He's a specialist there, and he has been working very hard to convince many of our members in the community that the vaccines are safe. The vaccine is safe, and he'll speak about his experiences and all the great community work that's been going on to encourage all of our citizens to come forward and get vaccinated.